Hey everybody, you're watching the Morale Monologue, and my name is Michael Morale. In this episode, I'm going to be talking about a new delivery method for the Spinraza treatments. Doctors call it an SIC, and SIC is an acronym that stands for Subcutaneous Intrathecal Catheter System. What it is it is a subcutaneous port that's planted just below the skin level, and from this subcutaneous port, there's a line, also known as a catheter, that's run from the subcutaneous port into your spinal column directly into the central nervous system. A lot of people who have had spinal surgery, whether it be fusion for either an injury or for scoliosis, many of us are unable to receive the Spinraza treatments because doctors are unable to find an opening within the vertebrae to inject the Spinraza into the central nervous system. So doctors are looking at this SIC, or Subcutaneous Intrathecal Catheter System, so that it will allow those patients the ability to begin their treatments. Now, one of the reasons why I did this PowerPoint presentation is in the European Union, also known as the EU, they've decided that they're not going to use the SIC system. So in my PowerPoint presentation, I give the reasons why they made this decision. And it's a decision that I strongly disagree with. But please watch the PowerPoint presentation, and afterwards I'll come back and I'll give you my final thoughts. Thank you. SIC delivery of Spinraza barred in the EU. This delivery system involves the use of a subcutaneous port that is buried below the skin that has a catheter system that runs directly into the central nervous system of patients who are actively on treatment with Biogen's drug called Spinraza. This subcutaneous port will allow those who would otherwise be eliminated or disqualified from receiving this treatment the ability to receive it. Right now, the only way to administer the Spinraza treatment is through an intrathecal injection, otherwise known as a lumbar puncture. Infants and small children are at risk at doing this procedure, and this new, possible subcutaneous intrathecal catheter system would give hopes to not only those individuals, but it would also give hope to those individuals who have had spinal fusion due to scoliosis. An article posted in the SMA News Today website discussed how spinal surgery shouldn't preclude access to Spinraza. This was an argument by a Polish SMA expert by the name of Dr. Thomas Podacek, an orthopedic surgeon in Poland. Dr. Podacek stated the following, quote, "As far as I know, it's not possible in Europe because the SMPC, or the Summary of Product Characteristics of the EMA, prohibits the use of subcutaneous access ports in the long term. It has to be administered through a single access route, so in Europe, this is not allowed." End quote. Kasper Rzyński, president of Fungica SMA and organizer of the Warsaw Conference, said that because Spinraza is not a one-off treatment, but has to be repeated every few weeks and then every few months, doctors preferred not to take their chances. Rzyński, who has a 9-year-old daughter with SMA type 2, stated the following during a press conference, quote, "Normally, when you do a spinal jab, the patient has to bend. If the patient is unable to, it's next to impossible to insert the needle between the vertebrae, especially if they were previously undergoing spinal fusion." End quote. At the end of his statements, Rzyński said, quote, "In some countries it is expressly stated that those who have had surgery are excluded from Spinraza. I think they should be given a chance, and it should be up to the treating doctor, not the government, to decide whether or not to undertake the procedure." End quote. Okay, so I hope you enjoyed the PowerPoint presentation, and I hope you got some information out of it that you can use as well. I strongly disagree with the government making this decision. I think that I personally agree with the doctor, and that is that the doctors that are treating these patients should have the opportunity to make this decision as to whether or not they use this SIC system for the patients that they're treating. I think that if they do use the SIC system, more patients that were otherwise disqualified from receiving these treatments should be able to start receiving them, and it will change a lot of lives. So please keep your fingers crossed, and let's hope that the EU changes their mind on this terrible decision. Hey, if you enjoyed this episode of the Morale Monologue, give me a thumbs up, and please subscribe to the SMA News Today YouTube channel. We would greatly appreciate it. When you do subscribe to the channel, make sure that you click on the bell icon to be notified of any new videos that we do. We at SMA News Today hope everyone's having a fantastic day. And until next time, take care of yourself. Bye-bye.